Good afternoon, welcome back. This is Simon Adim. If you haven't met me before, I'm a nurse from Southeast England. In today's video, I'm going to tell you about healthcare support workers' duties. No, not about duties, about their salary. Yes, because a lot of people, they've been asking me how much do they get their take-home salary after deduction of the council tax and the other pay as you go, pay as you earn, and also deduction of national insurance and pension. How much do they take home after all these deductions? So this is all we're going to talk about in this video. If you haven't subscribed, please do so. I provide information about UK nursing, how to become a nurse here, how to become a healthcare support worker here, and how to get accommodation, how to handle patients, each and everything you can think of. You can find the information about all my videos on this channel. So if you are interested in working here in the UK, please consider subscribing. You will never regret it. Okay, and if you're new to this channel, welcome on board. If you're a returning viewer, thank you so much for coming back. Let's dive into the video without any further delay. So healthcare support workers, there are many names for this job. Healthcare support workers, carer, senior carer, healthcare assistant, um, um, domiciliary carer, or senior carer. All these names are for one designation, one job, and all the healthcare support worker, they are called HCSW, also HCAs also. So all these names are for one job title. Okay, so healthcare support workers, what they do here is their job is to look after patients. Apart from medicines, they do bedside care to the patient, bedding, bathing, also serving them food, helping them to eat, taking them to the toilet, providing them help with walking, or also to, there are many jobs. They are not limited to only these that I'm telling you, but there are many other jobs also. If there is any dementia patients, if there is any difficult to handle patient, or the staff is struggling to handle, sometimes you just look after for that person only also. Okay, so for healthcare support workers, there are many jobs, and we as nurses, we are a part of the healthcare support workers also. So whatever they do, we do that as well. So our job is not limited to doing drug round, taking vital signs, and also it's not limited to these also only. All right, you look after the skin care also, like if there is any pressure ulcer, you do the dressings, you do the if there is any cannulation, if there is any NG insertion, if there is fluids, if there is any documentation, nursing care plans, you make those. All those things are for the nurses. All right, additionally, they can help the support workers also with patient washing, with the if with patient meals, and also with other things like blood sugar checking and all those things, or turnings. If there are turns for the patients, they cannot turn by themselves. You as nurse, or you as a healthcare support worker, is your responsibility to give them turns as well. Okay, so you are not alone. If I'm telling you the responsibility and duties to the healthcare support workers, they are not alone in this. Okay, we nurses, we help them also with each and everything. Okay, so you get 10 patients per day, and you and your nurse, 2 persons are there, unless if patient is more dependent on the nurses or on the staff, like they are assistant of 2 or assistant of 3, then you may get extra staff. Okay, but basically you get 10 patients, 8 to 10 patients, for 8 to 10 patients per day for you and for your nurse. Okay, so we do each and everything. Okay, I know back home the relatives of the patients, they help also with patient bathing or toileting also, or with the serving food to the patient, or helping them to eat. In back home, in my country, we do help, relatives do help with all those things, all these things. But here you don't get any help from the relatives, very rarely, like very seldom, like only a few people I've seen that they'll come to feed their loved ones, to feed their mom or dad, or to their relatives. But very less people come here to help, to be honest. So we nurses, healthcare support worker, we do each and everything, from eating till bathing, to bathing. So let's say early morning you get up, right? You get up, you start your day, you brush your teeth, you take bath, we eat, and we dress up, and if so these all things we do for the patients also. Let's say patient cannot do that by themselves, then you are going to do all those things for them. Okay, if they can do these things by themselves, you are not going to do it, but just documenting it. If patient can do it by self, just ask them, have you brushed your teeth? And they say yes, you document it, and that's it. But if they cannot do it by themselves, you as a healthcare support worker, you as a nurse, is your responsibility to let them do that, provide them the things that they need to use. All right, so this is this is about the job of the healthcare support worker. Okay, so healthcare support workers, they were commenting that everything is for us. No, it's not for you. Okay, we are there to help you with each and everything. So if you are struggling with anything, you cannot handle the stress alone. My baby is trying to hold the tripod, it's going to fall over. Yes, so you are not alone, we will help you with each and everything. Okay, so me, just consider me as a nurse, I have my own responsibilities, I have my own things to do. Okay, I will also help you with your things, with bathing, or with serving food, or feeding the patients if I get time, isn't it? So if I don't have time, my priority will be to give medicines, right? If the time is for medicines, and there is also the same time there is lunch also. Okay, so what should I do? I'll prioritize doing the drug round than feeding the patients. Okay, but when I'm done with my drug round, of course I can help you with the feeding as well. So just take them into your shoes. Okay, just take nurses into your shoes also, and think about it. If they are doing something, maybe it's more important than feeding the patients. Of course feeding the patient is important also, but we as a healthcare, we as a carer, we need to prioritize what is important, we do that first, and what is less important, we do that at last. Okay, so for healthcare support worker, working hours, it depends on their contract, but most of the times it's 37.5 hours per week. Okay, so and the schedule is like it's you can do a flexible schedule also. If you want to do morning only, you can do morning only, but you need to complete your hours. If you want to do afternoon shift, you need to complete your hours. So morning shift is from 7:30 till 2 o'clock. Okay, and the afternoon shift is from 1:30 till 8 o'clock. All right, and the night shift is from 7:30 to 7:30, 8 o'clock in the morning, 7:30 to 8 o'clock in the morning. Okay, so 37.5 hours per week, you need to complete those hours whatever shift you do. What most of the times what we do is we work 4 days a week, so 11.5 hours per day, for 4 days in a week, and 3 days in the following week. Okay, so it makes a total of 37.5 hours per week. And the salary is salary to take home is usually around 1300 to 1400 if you don't do any extra shifts. if you don't do any overtime. Okay, then that's your take home salary, 1300 to 1400. Some people earn around 1600 also if you work on the weekends. So if your shift, you are going to work 4 days, isn't it? 4 days in a week and then 3 days in the following week. Okay, let's say in that 4 days you work 2 days, Saturday, Sunday, then your salary will be higher, because on Sundays you get 30% more, and Saturdays around 10, 15 or 20% more. Okay, so if in those 4 days you have Saturday, Sunday, obviously your salary will be higher. Okay, and the following week you have 3 days work and you have 4 days off. If you want to do extra shift, you can do that also. If you want to do overtime, you can do that. Okay, because you have plenty of time. If I'm working 4 days in a week, I'll be having 3 days off. In those 3 days, I can work one bank shift, or if I want, I can do one overtime shift, or if I want, I can do two bank shifts. All right, and in the following week you will only work 3 days, right? So in 3 days you work, and then you have 4 days off. In those 4 days, again, if you want to do extra shifts, you can do that. All right, you just need to complete 37.5 hours per week. So 4 days, 11.5 hours per day we do for 4 days, and the following week we work 3 days. Yes, just to make it simple and short. Okay, so there are lots of opportunity for you to do extra shift. Nowadays I'm not working, but I've heard from my colleagues that there are very less shifts available. So try to book in advance. If you want to book extra shifts, try to book them in advance, so you have your shifts reserved for you. Okay, so you can get some extra money. So take home is around 13 to 1500, depends what days you work. If you work Monday to Friday only, then working days salary is less. On the weekends the salary is higher. Okay, so that's it, I think, for the healthcare support worker. And duty is not that difficult, guys. I know it's difficult in explaining, and if you're listening to it, you will feel like it's very difficult, but it's not. You get used to it, and if you have passion for that, you will not feel like it's difficult. All right, so can you hear it? All the alcoholics, they throw all the wine bottles here. Too many drunk people, you will find them here in my area over the weekend. All right, guys, thank you so much for watching. I hope you like this video. I'll see you soon in the next video. Till then, take care. Bye bye. God bless you.